Matthew Holt, was your Valentine's Day filled with love and kisses and candies and flowers? Uh-oh. I take it by the look on your face, that's a big fat no. It's the February 15th episode of Health Tech Deals. So maybe these startups will feel a little bit more love than you feel right now. What happened?
Oh, it's just that Valentine's Day in America is stupid, right? Because your kids, I don't remember this when you were young because it was a long time ago, but your kids have to take Valentine's to like everyone in their class has to
Yeah.
everyone about.
Yeah.
But it's stupid. And then this
Why
morning
is it
it became
stupid?
apparent that one of our kids hadn't done his Valentine's. It was a bit like, it's just a panic. In England, there's none of that bullshit. In England, you send an anonymous Valentine's card to somebody you like, and they don't know who it is. It's a big mystery. And the key is, do you get a few Valentines with like question marks and not knowing who it is in it? And that's much more fun. There's a bit of intrigue and a bit of mystery. In America, it's just excessive love and it's just stupid.
I feel like that is very English in the let me bury my emotions behind this this question mark. And also, let me be curmudgeonly and not give everybody love. Let me just give one person.
Exactly. Maybe not.
But I'm not going to admit it. I'm going to bury that deep inside and keep calm and carry on. Isn't that how it goes?
All I want to know is, Jess, is clearly, you didn't get the flowers I sent you. What happened?
Yeah, I don't know. Where are they? What happened? There was a mysterious bouquet of flowers that was delivered with question marks. Is that you?
Ooh, me or one of the other?
There were no flowers here at the DaMassa house.
One of the other. If you want, you should be sending. I can't believe all your.
I buy myself flowers all the time. I do. I like having them around.
Okay, do you want to see who else got some love, like some, money love?
Some real love. All right, let's see it. All right. ANDHealth gets 57 million. Francisco Partners and Health 2047 AMA's fund are both in this one. Matthew Holt, what do you think?
So this is the former CEO of CalvaMy Meds, which sold for $1 billion to McKesson, which was doing prior authorization for like online pharmacy, which is and this is supposed to be a virtual center of excellence, which the rest of us is. It's another full stack clinic. It's just been going for 3 months. Says it has good results for migraine. Its first deal, and it's going to be doing autoimmune diseases like arthritis and psoriasis and Crohn's disease. It's another one of those entries. It's well funded, but there are a lot of people thinking about those spaces.
All right, ANDHealth, speaking of crowded spaces, Symptom Checker, they get another 30 million, brings their total up to 189.
Yeah, they just went back and filled the round again. They were talking about coming to the US in a big way. We'll see if they actually do. They got a big grant from big infusion of cash from Bayer last summer. That was the big round. We'll see how they do.
All right, Minded gets 25 million. This is a mental health play, but they've also got the psychedelics in there.
Yeah, don't understand this one yet. This is, they're going to go from a few states to most of the states. This is obviously following fast on the footsteps of Cerebral. So they're going to say they're going to do online prescribing, get access to a psychiatrist. They also said not only the sort of the normal stuff, but they're going to do genetic testing for more accurate prescribing, and they're going to do psychedelics for treatment-resistant depression. But I'm sure they're just going to be starting with the anxiety and depression like Cerebral.
All right, what about Expressable's 15 million? Brings their total up to 19.5. What do you think about this one?
Interesting. This is like an online speech therapy. This is another wraparound. Go to their speech therapist. And also he's doing wraparound, obviously, with mental health, counseling and then stuff for the person while they're not in the counseling. This is stuff for the speech therapy while they're not doing speech therapy. Very common for kids. A big problem. A lot of kids have issues with that. So interesting to see how this goes. F Prime isn't leading this one.
Okay, and how about Curve Health? They get 12 million. This is a comms platform for nursing homes.
Yeah, this is, I think, interesting, highly specialized, right? You've got the whole issue of people in nursing homes don't get very adequately serviced by, a lot of them get called and go to the EMR. There was a bunch of these. There was one, I can't remember the name of it, but it went bankrupt trying to fix this problem about 3 or 4 years ago. Somebody having another go at it. Can you get, telehealth into the room managed by the nursing home staff with the physicians, with the physicians at a distance providing care, and therefore preventing them having to go to the EMR, to the ER. Yeah, it's a good idea. We are poorly, and since COVID, clearly we poorly treated people in nursing homes. So hopefully this kind of thing will work out. I don't know whether this is going to be the answer, but it's certainly the right sort of interesting area that Curve Health is going after.
Is this the same kind of space that Signify Health is in, where they're actually doing much more in that space? Is this just a virtual care piece of that?
I think this is just nursing homes only and just a telehealth solution only.
Okay.
But I think my impression of Signify is actually delivering people as well as technology.
Yeah, the whole thing.
Home. I don't know how much you know more about than I do. How much are they doing in nursing homes versus in the home care itself? I think it's more in the home care. But you're also seeing a ton. I spoke to a company called Nice Healthcare. There's obviously Dispatch who are doing a whole bunch of people who are doing like services to the home to sort of wrap around virtual care. Some people are looking at complex senior care as that part as well. Devoted as and Clover both have little sub-medical groups doing that. But
CareCentrix too, right?
Yeah. So a whole bunch of people are trying to figure out that, how do we move care to the home? And of course, medically home dispatch and others are doing hospital at home. So this to me looks like one little piece of it, but it is a very poorly served place. And, during the pandemic, right, people were in nursing homes were almost semi-abandoned because they couldn't get the staff and everything like that. And so getting care to them of various types, hopefully is something that should be more of.
Interesting.
I think a bunch of interesting stuff today because, everything is saying, with the exception of Minded, which is like an add-on, competitor to Cerebral and others, everyone else in there is like, getting at some interesting things like, can you do a better job for psoriasis or migraines? Can you do a better job with symptom checking? Can you do a better job with speech therapy? A lot of areas where, you don't have great communication between the professional staff and the patient, especially when they're not in that physical visit. So,
do these businesses scale, Matthew, as like their own standalone thing, or are these like prime acquisition targets for something that?
If they all work, they end up being prime acquisition targets, right? Because you're going to end up. Even people like Dispatch and Heal, and also the big health plans and Optum, right, who are doing more and more of this stuff. They're all going to be acquiring these companies when they figure out how to make the model work. I spoke, as I mentioned, to the CEO of Nice Healthcare, which is out, I believe, out raising around now, which is a nurse practitioner led. It's mostly virtual care, but they do go into the home. A whole bunch of similar plays. We will see how it all plays out.
Oh, we're getting a phone-in question, huh?
I hung up on it. It was probably another of my gambling debts trying to be
much more important than us on this show. But so we'll just wrap it up for you. How about that?
I have to go and pay off my gambling debts from the Super Bowl. What are you going to do?
Is that what happened?
Bound to be.
The expensive bouquet of flowers you bought your wife, got to pay for that now for Valentine's Day.
Yeah.
Okay.
Maybe would have bought a bigger one had I won some money in the Super Bowl, but what are you going to do?
Next year.
Between that and my Teladoc trading.
Things are dire here. To send some love to the man who needs it the most, hit him up over there at BoltyBoy on Twitter. I am at Jess DaMassa. And to sign up for the email newsletters from thehealthcareblog.com, which will contain these cute little Health Tech Deals episodes, in addition to the best of the blog for the week, sign up over there at thehealthcareblog.com.
Are we prepping for the big announcement of the WTF Health podcast or not?
We've been like ramping it up too much.
Okay.
We're so
dialing it
close.
down. It's
So
somewhere
close.
in the process. The
problem is RSS feeds, but I'm learning a lot and it will be there. I'm so excited, finally. All right, Matthew, we'll see you soon. Take care. Bye, guys.